Okay, let's get started. This is my second patient note regarding to the USMLE Step 2 clinical skills board preparation. Anyway, quick introductory. I put a time set here. It allows me 15-minute screen recording and make a video even in an actual real exam. We're not allowed more than 10 minutes. This is the first thing to say. Another thing, the purpose of these notes basically not to impress anybody. Contrary, it's like working on my own mistakes. In my case, like if your English is not your mother language, like in my situation, we have to practice on our English to get the better efficiency in understanding and communication. Let's see how it works. If I can manage it in a 15-minute. And the clinical scale. Case 2, that starts with the painless bloody urine. Patient presents with the painless bloody urine. And we will start first diagnostic studies. I think it's important to start with the diagnostic studies because as soon as you finish the conclusion part with the patient, you're getting outside, you already developed some plan what to do. That's why it's easier. Because it's a close proximity, you just repeated the same thing to the patient and you start with the diagnostic studies. So it makes more pretty logical approach. So first what we do genital exam. Purpose what? To exclude any external causes of bleeding like trauma. The second thing, we do the rectal exam. The purpose to evaluate the prostate and the prostate cancer situation, or the benign prostate hyperplasia if it's developed and its consistency, all this stuff. So the third is a cystoscopy. Cystoscopy is a very most efficient diagnostic method because it allows us to take a biopsy at the same time if the purpose of these, if the cause of these was urine bladder. That's why the biopsy is very important. It's the most diagnostic tool. And the third, definitely we have to do renal ultrasound. Renal ultrasound. In order to exclude renal ultrasound, if we have any urolithiasis, we can possibly see any stones, and it depends on the proficiency of the person who does this ultrasound. So in urine analysis, it's very important to exclude the bacteria urea, which can cause also hematuria. CT scan, it's pretty much common in US healthcare system. CT, specifically not the brain, or it's abdomen, and did I get spelling? Abdomen and the pelvis. The third, prostate-specific antigen, which is necessary to evaluate the prostate and to give a secondary thought if there's a prostate cancer. And it's correlated with the benign or malignancy. The amount of the prostate-specific antigen is correlated with the benign or the malignant abnormal changes happening in the prostate tissue. Anyway, this is what we do in a diagnostic. In the second, we start with the first we start with the bladder cancer. I better type faster because I'm running on all of the time. Bladder cancer. That's the supportive. Hematuria. The same thing. Copy for the diagnosis. It's going to be the same thing here. What's the, did I spell it right? Okay, hematuria, screening on urine, screening on urination, as they can be second class. But the finding supportive of the bladder cancer, because as the cancer starts going to the protruser, it's going to make it less efficient to expel the urine out. If there's a blockage in the urine urethra, then it gives us a weak urinary stream and then dribbling. Another thing, the social history is very important. The patient works as a painter. Probably he was exposed to industrial solvents, eating raw. What else? He's a smoker. One pack per day for the last 30 years. The same findings. The second, the most likely, I've missed this part, it's the bladder cancer. Bladder cancer, it started to bladder cancer. And the third, as he said, urolithiasis and the renal stone disease. What is the supportive? Hematuria, copy, paste, stringy urination also can be one of the attributes of the urolithiasis. Another more important cause, the vertebral angle. Tenderness would be relevant. I think I did a very big mistake here. I have to cut it and transfer all of it here. Don't do this silly mistake in a real exam time. God. Add some raw. Works as a painter, smoker. It goes all here. No, actually, this is the function to change it. Let's change it here. Yep. Well, it was a good discovery to find out it works this way too. The third is a non-bladder cancer. The third is a benign prostate hyperplasia. Hematuria supports this. No, hematuria is not specific for benign prostate hyperplasia. It's more, it's like a secondary polyuria. Polyuria. It's a secondary because the kidney is producing the same amount, but the bladder cannot expel enough. Then there's just always some left over of the urine portion. It accumulates and causes the polyuria, secondary polyuria, and not getting up at nighttime to use the bathroom. And weak urinary stream and a dribbling is could be specific for the benign prostate hyperplasia. So basic here. What else could be? Straining on urination. Applying some abdominal muscle force to expel the urine out. Physical examination. In a general picture, it's very important to say that patient is in no acute distress. He's not experiencing any pain. Vital signs within the normal limits. Chest. What about chest? The chest is clear. Sounds. Heart. Relative rate. Regular rhythm rate. Normal. This one. And S2. Murmurs. Then head down. Now tenderness. Now this understand it. hear vowel sounds. Positive. In the beginning I should put soft, and then it goes with non-standard breath sounds. And in abdomen we found it's a mild right costa vertebral angle tenderness, which is the supporter of the urolithiasis extremities. Extremities, no edema should be enough. History of present illness. It's a 57-year-old male. Presents with one episode of painless bloody urine. Yesterday morning, it's what's it, 2 years history of urination. I would say gonna just start copying. Weak urine dribbling. What else can be copied and pasted? Polyuria. Copy. Paste polyuria. No. Ever. That we are excluding urolithiasis, or ROS. What is negative? Except above. Allergies. No drug allergies. Past medical history, patient had gout, current meds, allopurinol to exclude food not taken with amphetamine, which can cause the urination. Social history, very important to say he's a painter because there's a possibility to be exposed to industrial solvents, which can cause the bladder cancer. He is a smoker. It's very important to say he is a smoker. One pack per day. How long? 30 years. And what's the family history? Father. Started doing a ton of mistakes on spelling. As I said, the English is not my first language. It's a big problem. Father had a kidney disease. Very important, probably. It's like a abdominal dominant polycystic kidney disease. This is probably this one, as I mentioned. What else? It's basically, see, I am running out of time. It's the 14-minute. It's gonna finish within the 30 seconds. This is basically the history. It's more relevant, I would say. We don't have any time to type all of these. The physical exam, it's most important saying. The bladder cancer is the first most likely diagnosis. It's the second urolithiasis. It's the third benign prostate hyperplasia. Diagnostic studies, I put all of them. What I could say about the episode, it's a nocturia, no abdominal pain. Okay, if I have time, I can say